So, moving on from this subject of what is the cause of diabetes and the types of diabetes, let's try to discuss about what could be the way that one could actually detect that he or her friends or relatives might have diabetes. So what are all the symptoms of diabetes? What are all the signs of diabetes? What are all the clinical features of diabetes? Because the blood glucose levels go high, what happens is this excess blood glucose in the body in turn leads to lot of leakage of water through your kidneys. This leads to dehydration, which means that the individual who has diabetes tends to drink a lot of excess water, i.e. thirst is in excess. On top of it, the person would have what we call as polyuria. That means the person would be passing too much urine. There is frequency of passage of urine. During night times, the individual might wake up quite a few times, sometimes even 3-4 times to pass urine. This apart, if the individual were to have any nicks or cuts or any wounds, they might take longer than usual to heal. i.e., there is an increased predisposition to infections and wound healing might be impaired. Also, not to forget the fact that some people can have blurred vision, some people can complain of excessive tiredness, weight loss, lethargy, and this can vary from individual to individual. Remember, not everyone has all the symptoms that I mentioned. So it is very important to recognize when anyone has symptoms. And it isn't a bad idea, in fact, to actually get an annual screen for diabetes checkup in the Indian context, because we all are at increased risk of developing diabetes. After all, prevention is best, but if we were to have diabetes, screening is not a bad idea as well, that too periodically. And coming to women, they usually complain of what we call as thrush in their private parts. This is a very common way how they present to the doctors. In fact, I saw a patient today who presented to her doctor with itching in her private parts, and the doctor did blood tests which showed that she did have diabetes. So moving on from this subject, what you ought to do when you have these symptoms: consult your doctor, go to the nearest lab, see your family physician, get some blood tests done. What blood tests are done? Usually it is fasting blood glucose. Along with it, we suggest that people do a test called postprandial blood glucose, or if you go by the textbook way, you ought to be doing what we call as 75 gram OGTT, wherein they give you 75 grams of glucose along with water and recheck your blood glucose after 2 hours after checking a fasting sample of blood glucose. If these levels were to be more than what they ought to be, there are some magic numbers: 125 for fasting, around 200 milligrams per deciliter for your second hour on the oral glucose tolerance test, which is a standardized way to measure blood glucose and determine if somebody has diabetes or not. You are known to have diabetes, especially if you have the symptoms and signs that I mentioned to you. This apart, there is a test called HbA1c, otherwise called glycated hemoglobin, which gives us the 2 to 3 month last 2 to 3 month sugar average and helps us understand how severe or how bad the diabetes has been over the last 2 to 3 months. So this is a very simple and standardized way of recognizing if an individual has diabetes. So you might ask me, sir, is that all you need to do to detect or to screen for diabetes? Is that enough? No. When somebody is detected with diabetes, what we ought to do is we ought to screen for other conditions as well. What are all the other things that we screen for? We check for elevated blood pressure. We check if there is any protein leak from the kidneys, i.e. if there has been some damage that has incurred to the kidneys because of the elevated blood glucose. Because sometimes the detection of diabetes could be so late that the complications or effects of the high blood sugar levels could actually be showing up even at the time of diagnosis. We screen for any complications related to the eye, such as retinopathy. That means we look into the back of the eyes and screen if there has been any damage to the back of the eyes in the form of retinal damage. We also look for high cholesterol. If a person has high LDL cholesterol, which is a bad cholesterol, or triglycerides, which is another bad form of cholesterol. We also make sure that the individual has been educated appropriately as to what the person has to eat, what the person has to wear, because remember, foot care is very, very important in people with diabetes. Because if a person with diabetes were to walk barefooted and incur any damage to the feet, then they take their own sweet time to heal. Sometimes they may not heal even, and that can lead to amputations. See, a simple foot care measure could have prevented a very dangerous and ominous amputation. It is very important to educate our patients what are all the complications that they might incur if they don't take care of themselves. Let it be the microvascular complications that I mentioned, such as retinopathy, neuropathy, that means damage to the nerves, nephropathy, that means damage to the kidneys, or the macrovascular complications such as your brain stroke, heart attacks, and also damage to your feet by means of any occlusion of the blood vessels that supply to the feet. Is this all enough? No, there is even more to it. People with obesity and type 2 diabetes are at high risk of developing other problems as well, such as they can have what we call as fatty liver, which can result in cirrhosis sometimes. It's also called NASH in posh medical terms. So it is very important to screen for any abnormal liver enzymes, that means elevated AST and ALT or SGOT, SGPT enzymes, and to ensure that these people are already not affected by the elevated overweight scenario. So this is about your NASH and cirrhosis. Moving on from there, there's a very important element that is grossly neglected, which people shy away to discuss, which is in fact one of the complications of diabetes, and it is nothing but erectile dysfunction. Because of damage to the nerves and also damage to the blood vessels that supply to your penis, what happens is some men who have poorly controlled diabetes might in fact suffer from problems with their sex life. So it is very important to educate our men who have diabetes to take care of themselves and not to shy away from discussing with their family physicians or doctors who treat their diabetes, let it be endocrinologists or general physicians, about these problems. So these problems could be prevented if diabetes is taken care of appropriately, i.e. blood sugar levels are taken care of appropriately, if high blood pressure is prevented or treated in the right way, if high cholesterol is tackled and treated by means of statins if required, and in general the person is educated to exercise regularly, to take care of his or her diet in a proper manner. So it is a comprehensive holistic treatment plan and not something which can be done instantaneously in one go and forgotten for the rest of life. No. Many people ask me if they could reverse their diabetes. I think one can if it is type 2 diabetes, especially if it is at the earlier stages of diabetes. For instance, if a person were to have a HbA1c of 7.1, 7.2%, newly diagnosed with diabetes, is overweight by about 10 kilos, if that individual were to embark on following proper lifestyle changes, i.e. eating the right kind of food, doing proper exercise, taking care of himself or herself, taking the medications prescribed by the doctor, with time, with gradual weight loss in a proper manner, the individual might be able to reverse his or her diabetes and go into a state wherein the HbA1c is 5.4 or 5.3 and not a diabetic. There are many instances when many people could achieve this, that is by means of proper lifestyle changes and exercise and diet control. So it is still possible. They might be able to come out of their medications even, but this ought to be done under proper medical guidance and supervision. Here comes the importance of a dietitian as well, because a dietitian is a person who would guide you appropriately by checking through your dietary habits as to what you should be eating, what you should not be eating, what you should cut down, so on and so forth. Hence the reason why a dietitian forms or plays a key role in a diabetes team. One important thing which I want to discuss in this context, which we keep hearing fairly regularly, is a word called pre-diabetes. What is pre-diabetes? As the name indicates, pre means something before.